everyone, Dr. Jen here with the Wellness Way in Woodbury. So today we are going to talk about thyroid problems, what most doctors miss. Okay, I'll wait for a few of you to get on, but if you are tuning in and seeing this afterwards, I want you guys to check out the video that we did yesterday. It was with a patient, so check that out. Really great testimonial with only 6 weeks of care, and it can really show you, hi Christina, really show you guys what the heck this process looks like from more of a patient standpoint, or how this can benefit. Hi Terry, hi Carla. So you guys, we are going to get started here. Again, those green hearts for Wellness Way patients, red hearts for non-Wellness Way patients. But today, like I said before, we are going to talk about thyroid problems that most of your doctors will miss. You guys, thyroid problems are significantly on the rise. They're on the rise. So many people come in. I need to go back and watch the whole thing. There's not much at the beginning. You're good. So many people come in and are on thyroid medication. Did you guys know research from the American Association of Clinical Endocrinologists say more than 27 million Americans suffer from thyroid problems? That's a lot of people, you guys. And if you look at all the symptoms that are associated with thyroid disease, there are more out there suffering that have simply not been diagnosed. So let's talk about where the thyroid is. The thyroid is a small gland right here. Hi, Christy. Small gland right here. And it is small, but it is so important because it regulates so many different things. Let me read them off to you. Fat metabolism, temperature regulation, bone metabolism, growth hormone production, blood sugar metabolism, estrogen metabolism, bowel motility. There's so many different things that regulate your thyroid. But yet, are we tested properly is the question that we need to ask. And if you guys are suffering from thyroid dysfunction, what are some of those symptoms that you can be experiencing? Fatigue, weight gain, constipation, cold hands, cold feet, depression, increased cortisol levels, dry skin, hairs falling out, edema, headaches, or you sleep 10 hours and you want to sleep 24 more hours because you sleep and you want more sleep because you're so exhausted. You're so exhausted. Does this sound like you? Honestly, does this sound like you? Because most doctors, when you go in and you get tested, will test one thyroid value, you guys, and it is not even a thyroid hormone. If you're lucky, they'll test two. The one they always test and is based off of their diagnosis is TSH. It's thyroid stimulating hormone. It is produced in your brain, in your pituitary, released from there, comes down to your thyroid, signals your thyroid to make T4, and T4 is the other one that they will sometimes test, if you're lucky. But how do you know what's influencing TSH? TSH is that brain hormone, you guys, and they're telling you it's a thyroid hormone. That is so stinking crazy to me. Hi, Dr. Patrick. Most docs will only base it off TSH. So you guys, if your TSH goes up, there's two common diagnoses with the TSH value. If it goes up, hypothyroid, which is most commonly diagnosed, means a decreased function of your thyroid. If it goes down, hyperthyroid, which is potentially a Graves' disease. This, they can't medicate if it's at a normal level or it's low. The only time that they can medicate is if that TSH is high. Because what happens to your T4? It goes down. And what is Synthroid and Levothyroxine? It is a synthetic version of T4. So if TSH is up, they know T4 is down. So they give your body that synthetic version of T4. And that is one of the 4 potential things that can be going on with your thyroid. One of the 4. And tomorrow I'm doing a thyroid talk. So you'll learn about all 4 if you hop on. So that's why people on medications, Levo or Synthroid, sometimes don't see any difference because it's not a production of T4 problem. Did you guys know that those aren't actually the most common things that happen to the thyroid? The most common is Hashimoto's. But guess what? It's not tested for. The only way that you can test for Hashimoto's is testing the antibodies. What is Hashimoto's? It's an immune system issue where those immune cells are going to attack that thyroid. They attack that thyroid. Why do they do that? Because there's an increased amount of antibodies around your thyroid. But they don't test for it. They only test TSH and T4. But yet we're diagnosing people with Hashimoto's without even knowing where their lab values are. Or you get diagnosed with Hashimoto's and there's nothing they can do for you other than say that those antibodies keep going up and up and up. So where is the stress on your body that's causing this? Where's the stress? Because if you guys have those antibodies and that destruction happening, increased inflammation and impaired function is going to happen there. So, you guys, I've told you, autoimmune thyroiditis is the most common, hands down. This is why at the Wellness Way, we don't guess, we test. You guys, all of you out there that have had your thyroid tested, TSH and T4, it's incomplete testing. It's incomplete testing. Because you have TSH, T4, T3, free T4, free T3, reverse T3, thyroid antibodies, 2 of them. You have TSI. You have thyroid globulin binding hormone. You have so many different things. So many different hormones. But yet they're never all tested. How frustrating is that? You guys, tomorrow, we are going to go in depth on all these values. Where your thyroid could potentially be off. What can you do? Really, what can you do? What's iodine? What's tyrosine? What are all these different things that contribute to thyroid dysfunction? Or symptoms. What are you experiencing? We're going to go through everything on the thyroid tomorrow at 6 p.m. via Zoom. So no matter where you are, you guys can hop on and join in, because I just wanted to give you a tidbit right now of what the thyroid and how you're being misled is. What is the problems with it? Have you had them tested? If you haven't, it is important for you to come on this call tomorrow. If you guys know someone on Levothyroxine, Synthroid, what I'm going to do after this is I'm going to copy the link and I want you to share it with them. Share this event with them. It could change their life. Because what we do is we are figuring out what is causing the problem. What is causing all this increased TSH or decreased T4? What on your body or the thyroid antibodies, the destruction happening to your thyroid that they can't do anything for. And those antibodies, you're told, are going to keep going up and never go away. What can you do from a building up standpoint? You guys, this is where we need to understand which doctor to see when. This is not an emergency. Emergencies, we need to see the fire department. Because with an axe and a hose, they cannot build your body back up. But the carpenters, the Wellness Way, we can build your body back up. Because we have the tools to do it. You guys, understanding which doctor to see when. And it is so important. Hop on that call tomorrow. I'm so excited to do the thyroid talk. It is unreal. There are going to be a bunch of people on there. And it is going to be awesome. Danielle, I have had my thyroid tested, but by two different docs. One said I had low T3. The other said it was normal. Yeah. Did they only test TSH, T4, and T3? That is the question I have for you is, did they test everything? Do they know how the pathways are working? Hi, Megan. Hi, everybody that's on here. Hi, Robin. Hi, Amber. Yeah, Amber, sign up. It's going to be awesome. Hi, Maddie. Hi, Colin. Hi, Hannah. Hi, Preston. Hi, Emily. So thank you guys all so much for watching, but I do want to share with you what is going on this week. So we have done a lot. So yesterday we did a video with a patient. So if you guys have not seen that, go back and watch it. It is a patient that has been under my care for 5 to 6 weeks and her talking about her journey already. So super excited to share that. So check that out. Also, I'm looking down so I don't forget anything. On Sunday, I went live on foods that you can eat for No Sugar January. So if you are struggling right now with things to eat for No Sugar January, go pop on, check that video out, see what I got for food. I got a bunch of food at the grocery store this week since my favorite grocery store is now requiring masks. I will not go. And then on Friday at noon, we are going to do how to reduce sugar cravings. So we are going to talk all about how to reduce sugar cravings. So we have so much stuff going on, but tomorrow, most importantly, you guys, I'm going to ask you to share the Eventbrite link with your friends who are potentially have a thyroid problem, have thyroid dysfunction, that are on Levo or Synthroid or on a certain medication, so that they can know and be educated to be able to bring this information back to their doctors and ask questions. Because you guys, you should question every single thing that anybody tells you, and you should research it and look it up. We're here to educate you and provide you with the information. So you guys, I encourage you to sign up for the talk, even if you don't have a thyroid problem. I can guarantee you someone you know is going to either end up with a thyroid problem or has a thyroid problem that you don't even know about. And by you talking about it, they are going to realize that there is potentially a different way. So I will share that link below. And if you guys are doing no sugar January, or I always say January, no sugar May, I hope it's going well for you. So I'm super excited it's been 5 days. I've been doing it for 10 days. So I'm really excited to see how No Sugar January goes, but also I want to go live on Friday at noon on how to reduce the sugar cravings. So you guys, it was awesome having you all on. Please, 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 if you have any questions, please sign up for the talk tomorrow and interact for me. I don't care if you're a Wellness Way patient or not. If you're a Wellness Way patient, start interacting. It'll get everybody else interacting on the call, and it'll make it super fun. So it is via Zoom, so I will share that link. All right, you guys have a great rest of your Tuesday, and I will do that talk tomorrow via Zoom and then live on Friday at noon. Have a good rest of your Tuesday. Bye-bye.